Thank you, Mr. Doggett.
Thank you very much. Thank you for your testimony. Just as there's no miracle drug to cure every ailment, there is not a panacea to high health care costs. You're part of the challenge of addressing that, but hardly all of it, and how we end a system that costs Americans 2 to 4 times more than people in other developed countries for their health care, and yet we end up sicker with higher rates of obesity and chronic disease. I say you're only a part of the challenge because while there's much talk of fraud, fraudsters take advantage of an inefficient system and lax oversight by the Trump regime. More concerned with yelling fraud, as we have heard repeatedly here and on the floor of Congress, the regime and their enablers have been using fraud as an excuse for a cruel agenda of cutting access to health care for millions of Americans and blaming insurers. In blocking the affordability credits, Republicans pointed to a recent GAO study on fraud, ignoring the fact that the fraud which was reported was documented as committed by hundreds of insurance brokers, not a mother out there seeking care for her sick child. Yet it is the child that suffers when this GOP agenda of yelling fraud really means replacing Obamacare with nothing care. I renew the challenge that I have made here and in the Budget Committee that if these Republicans are the least bit interested in preventing fraud, look beyond these insurance executives. Instead, get in a witness from the administration, which you have feared to provide in public session, like Dr. Oz, who can explain perhaps why the Trump regime reinstated 850 insurance brokers that had been suspended for wrongdoing last fall by the Biden administration. Let's hear whether CMS has issued a single civil monetary penalty for fraud, whether they are holding insurance brokers accountable in any way. While Trump won't offer a penny of help to families struggling with marketplace premium hikes, he continues to pardon healthcare fraudsters and deny their victims restitution. It's essential that the Senate pass our Democratic bill to restore the tax credits, and the claim that he has some great health care plan is as phony as the dimensions of his plan over the last decade or so. This is simply a plan to shift money to insurers from one account to another. He claims he can give the money directly to the consumers, but a company like United, Mr. Helmsley, is not limited to Obamacare policies. You have high deductible plans that you sell with health savings accounts. You have certainly Medicare Advantage plans, as many of you have, which I understand is perhaps the most profitable sector. And taking the money out of affordable health care credits and shifting it there is not going to change the status necessarily of insurance companies, but it will certainly hurt consumers. And if you want a real example of waste and abuse, I think it is forcing Americans to pay for Medicare Advantage premiums for military veterans with the Veterans Administration actually providing the medical care. Yet the VA is prohibited by law from collecting a penny from any of your companies. That's a great business. An insurer collects the premiums, but the VA at taxpayer expense provides the care. Unfortunately, my bill to put a stop to this nonsense, like other anti-fraud bills I've filed in this committee, cannot even secure a hearing. Mr. Helmsley, on a more constructive note, I would ask you one very narrow question about a distinguished surgeon in my community of Austin. Dr. Elizabeth Potter and the Red Bud Surgery Center are located there in Austin. She's been unable to obtain in-network status with United Health. She spends hours negotiating authorization to perform surgery at nearby hospitals, which lack the level of equipment and safety that she could provide at a fraction of the cost of the hospital. I know you have many responsibilities. I would simply ask you to commit to personally investigate this situation, give your folks the name and address, and engage in good faith negotiations and report back whether this matter can be resolved.
We will do that, Representative.
Thank you very much, and thanks to all of you.
Mr.